Endometriosis took away my house, my boyfriend, my job, and CIGC gave that all back to me.
Surgery a lot of times is a very scary concept. For example, with large fibroids or advanced endometriosis, their doctors are telling them that the only way to have the surgery is to have a large incision or to do robotic surgery, and that scares women even more. Dual-port GYN alleviates their fears, and after the consultation, they're not only less scared to have the surgery, but really excited to start their life as a disease-free person.
I felt back to myself almost immediately versus the other surgeries where I had multiple incisions. It took me a lot longer to recover from than the dual port did.
Endometriosis is a common condition in many women, with some estimates indicating that it may affect over 5 million women in this country. It is a debilitating disease causing pain, scar tissue, and infertility. This is a section down the middle, bladder, vagina, rectum. Now I'm going to fill in the endometriosis for you because you can clearly see what's going on. This is the lining of the uterus here, okay? The lining over here, okay? And here. This is the endometrial lining. When this lining goes to the outside, like this, and implants on the ovary and causes endometriomas, that's what's causing your bleeding and your heavy pain with menstrual cycles. It can also go to the bladder. It can go down to the rectal area here and cause pain, on top of the rectum, on the uterus, to the other ovary, and maybe involving the fallopian tube. So you can see when the endometrial lining goes to the outside, it's endometriosis going to both the ovaries and other structures causing pain.
It became an everyday pain, and it felt like somebody was burning like the inside of my uterus and my pelvis area. And the cramps were unbelievable to the point where I didn't want to get out of bed.
The diagnosis of endometriosis can sometimes be difficult to make. An ultrasound may show collection of endometriosis on the ovary called an endometrioma, but in many patients, small implants of the disease are not detected by CT, MRI, or ultrasound, and laparoscopic surgery is often necessary to diagnose endometriosis. It's not known why some patients get the disease and others don't, but it is thought to be genetic or passed down from mother to daughter.
The implants of endometriosis can be throughout the pelvis and can also spread to the abdomen. Diagnosis is made by surgery, and treatment involves removing the implants of disease. It's absolutely important to remove all the implants at the time of surgery. In extensive cases, the disease has already caused severe scarring to both the organ involved and surrounding structures. Not removing all disease at the time of surgery can result in further growth of endometriosis, and that's going to cause severe, more intense pain, scarring, and infertility.
Our practice has seen too many patients undergoing multiple surgical procedures by non-specialty trained OBGYN surgeons and still not have all disease removed. The result is further progression of the disease, the development of extensive scarring and chronic pelvic pain, and for fertility patients, precious lost time, increased costs, and significant frustration.
In fact, this is one of the most difficult conditions to surgically treat, since the disease can spread to so many organs of the pelvis. Growth of the implants into the tissue causes scarring that can actually stick organs together and can increase the risks of surgery. In severe cases, the pelvis looks like it's been superglued together, and it's often very difficult to remove the implants unless special techniques are used.
CIGC uses special techniques in the treatment of endometriosis. Surgeons use Retroperitoneal Technique that dramatically increases the success rate for the surgery. This approach identifies all structures of the pelvis and creates a map for the surgeon to follow that avoids injury to vital structures while allowing for complete removal of all disease present.
Always see a fellowship-trained specialist in minimally invasive GYN surgery to ensure you receive the best possible care.
100% made the right decision to stick with Dr. McCool, no one else.
Seeing a person smiling and pain-free makes such a big difference to us, and this is why we do this.